Physician Spotlights. I am your host, Dr. Matthew Bechtold. Physician Spotlights is a forum for our outstanding physicians in the field of nutrition to discuss important topics and ideas. And with the help of ASPEN, we are bringing these videos to you. Our guest today is Dr. Olle Ljungqvist, who is a surgeon in Sweden. He's been a staple in the nutrition community for many years with many publications and really world-renowned research in many fields of nutrition. So, Dr. Ljungqvist, thank you for joining us today.
It's a pleasure to be here.
Out of curiosity, how'd you get started in nutrition?
I did some animal experiments as my PhD, and I was studying the role of glucose as an osmol in hemorrhage. Surgical question. And I used animals that were just briefly fasted enough to deplete them of their glycogen so they couldn't release any glucose when we were bleeding them. And that turned out to change everything in their reaction. And so short-term fasting made a big difference. That was new in those days, actually. And then that got me thinking, hey, we're fasting everybody before surgery. Mm-hmm. So I came up with the idea that maybe we should get metabolism going before the operation. And the way that we could do that, the easiest way, would be to give a carbohydrate load just to get that insulin kick before the operation. So I came up with the idea that we should carb load patients before surgery instead of fasting. That's how I got started.
Well, that's fantastic. You know, you've done a lot, but what are your proudest accomplishments in the field of nutrition?
Well, I think we always had an interest in trying to see if we could get patients to recover quickly and quicker better and avoid complications. And I was always very interested to see what we could do by altering metabolism and reducing the metabolic stress to surgery. And obviously the carbohydrate was one of the ways that we could do it. I then got interested in minimal invasive surgery, which is another way to do it. Pain management, a third way to do it. And it just goes on. And eventually we started developing enhanced recovery after surgery, or ERAS. So I got together with another fellow surgeon from Edinburgh, Ken Fearon, who was a fantastic guy. And we decided to start working on these ideas of enhanced recovery. So he and I started ERAS.
Oh, great.
Yeah.
Well, you've been in nutrition for a while now, and I'm wondering, how did mentorship play a role with you, and maybe how did mentorship you do for others?
I was very fortunate. I had, I was a very young surgeon. Here I was challenging probably the best known rule in medicine overall. You gotta fast before you go to surgery. You die on the operating table if you don't. I mean, everybody knows this, right?
Right.
So here I came up with this idea, but I had a professor of surgery, Bertel Hamburger, back at the Karolinska, who was very supportive of me challenging. And I was also fortunate to have an endocrinologist, a diabetologist, who taught me all about how we can study insulin sensitivity and insulin resistance. So that's sort of where we got going, and they taught me a lot about supporting young people with new ideas, and that's what I've been trying to do ever since. I've been very fortunate to have some absolutely outstanding people that have been working with me and that are now making fantastic careers in different parts of the world.
Well, that's great. I know mentorship means a lot to folks, getting them involved and helping them out through their career.
Yeah.
And I'm sure they appreciate it. And
well, it's been fun. It goes both ways. Mm-hmm. So I think one of the best feelings you can have as you're getting older is to see one of your young chaps standing up there and doing a real good job, and you see the satisfaction in their eyes, and yeah.
Absolutely, absolutely. Where do you see the future of nutrition?
Well, nutrition is going to get more and more integrated into our daily care. And I could, from my perspective in surgery, it is absolutely clear that with enhanced recovery protocols, we're getting a lot more nutritional focus and a lot more nutritional input to why we're having the better results. And also we're getting a lot more people to use nutrition as well. In fact, there are studies out there to show that you go from hardly no screening to almost 100%. And then with that, people start to realize, hey, we got to also, take the next step and give the patients that need it the nutrition. So I think that's what we're going to see in other situations as well.
Well, that's great. Well, I look forward to it. Look forward to the research.
Yeah.
I'd like to thank Dr. Ljungqvist for joining us today. I'd also like to thank ASPEN for their partnership in this forum. Have a great day, and we'll see you next month.